Assalamu alaikum, very good morning and Suprabhatam to one and all. It's a great time today, and previously we were completed around for 01 to 39 points were completed, right? So totally we do have 67 points. Among them we were completed for 39, and then hopefully we are going to start now from UB40 and then UB55 to UB67. How many points are remaining? 55, 65, 67, right? So totally 13 points we're going to address today, and later we'll do the practical session. Once completed that, then there will be the important notification to one and all, and further we'll talk about the internal dragons and external dragons. In fact, previously I told few small concept about that, but still there is a I'm audible in the Zoom, by the way. There is a important
Yes,
topic.
Sir.
Yeah, important.
Yes, sir.
Good.
Yes, sir.
Importance of that, how we will going to do the implementation by using the dragon acupuncture. The name is numerous. Acupuncture is existing in that the dragon also is the one concept. So now let me see about the UB40 point, that's called as a Wei Chung. Wei means is the stomach and Chung means is the center, but where this point is exactly located, and most of the acupuncture practitioners, perhaps maybe few of them, they just mention that point, but otherwise most of the people will get the interruption where exactly that point is located, because anatomical locations are the different, the picture which is existing on the UB40 that get differs. But based on that, where exactly that high conductivity of the electrical conduction to be taken place, that point to be known as that is a UB40. So in fact, I'll try to give you a small description about all the points, and further we'll step into the practical. Then I'll give you some hints about that. So what are the significant and properties and mechanism of that particular points would be good. But now let me see about the Wei Chung. There is the location. Normally this is that there is the diamond location is there, or the diamond palace is there on the popliteal fossa, right? Popliteal fossa, how can recognize? This is which fossa? This called as a suprasternal fossa, right? This called as a bicep muscles. Bicep muscles, this is the cubital fossa, right? This is the snuff box, is the hollow fossa. Likewise here also you can find, so exactly on the popliteal region, but this region to be known as a popliteal region. This is the anterior knee region, and this is the posterior knee region. In that posterior knee region, there is a fossa called as a diamond shaped one fossa is there, that to be called as a popliteal fossa. Some authors has been written, yes, this point is located on the popliteal fossa, but however we need to understand precisely where this point is located. Midway between, that means there are the two midways. In between the one point is located. What is the midway between? Bicep femoris tendon and semimembranosus tendon, right? There are the two tendons are there. So you cannot find like this. Whenever the patient is lying prone position, this is the supine position, this is the prone position. Once the patient is lying down in the prone position, right, facing downwards direction, that time you cannot find this popliteal fossa precisely. When need to semi-flex the leg, then you can find the two tendons, that to be known as a biceps femoris muscles. The muscles will become one tendon, the tendon to be known as a biceps femoris tendon. Now this is the biceps femoris tendon. So these muscles called as the biceps femoris. What about this biceps, right? Bi means is the two, the muscles. So there are the two muscles are there. So this the biceps muscles comes here, hamstring muscles we called, but in that gluteal muscles divided into two muscles. One is the biceps lateral, biceps medial. Likewise it comes downwards direction. The biceps lateralis tendon. So the tendon you just find out that one location. Then the another tendon is there. That tendon to be known as a, remember my name, semi-membranous, not semi-membranosus and semi-tendinosus, two tendon is there, but semi-tendinosus tendon in that midway between these two tendon, exactly in the depression that UB40 point is located. Hopefully we will see the practically where exactly once you can have a look, that time you can easily identify, yes, this is the right point. But most of the times we apply, yes, lying down and then apply the needle, that's quite enough. That is not something, is not exactly that particular point. But hopefully why this has been mentioned popliteal, because there are the muscles called as a popliteal muscles are existing in that popliteal muscles, but there is the one specific point UB40 is located on one particular muscle, that muscle to be known as a plantar muscles. That muscles to be known as a, where is UB40 is located? On the PLANTER, plantar fasciitis, we says that, right? So that UB40 muscles that goes till to the plantar region, that's the reason the origin of the muscle taken place from the UB40 and then insertion to be taken place on the plantar region. So therefore that muscle, that particular point is located on the plantaris muscles. So where UB40 point is located. So once we apply surface level, then once we apply on the surface level, then the popliteal vein or the popliteal artery you are doing the insertion. Further you go to the deeper level. Perhaps it is advisable for the obesity patients 1 to 1.5 chun maximum can be inserted to that region. If it goes to the deeper level, that definitely touches to the one artery, that artery to be known as a popliteal artery. Then further it goes to the deeper level, then it is the posterior tibial artery is existing within that, then that posterior tibial artery you will going to damage if you will insert greater than 1.5 chun needles. So therefore it is advisable to use nearly 1 chun needle is safer side advisable on that specific point. This is something is amazing point. Here I can say puppy to that particular point. So since I use every day-to-day clinical practice, sometimes I use that particular point since this belongs to the command point. This belongs to the command point. So therefore, so this point is connecting point to one organ to other organ, that to be known as a which organ? Weichung. UB40 is equivalent to the one particular point, that to be known as a ST44 knee thing. ST44 knee thing, it is interconnected each other. Then the UB40 is the grandmother point and then ST44 is the grandson point. So connecting each other, indicating that UB40 is strengthening to the urinary bladder meridian. At the same time, then the UB40 takes the energy from the stomach meridian or the stomach organ, then passing energy to the, or regulating energy to the urinary bladder. If the patient having the UB40, that means is the urinary bladder deficiency. Remember, most of the time, normally I used to see patients, but in that most of the times for the women normally having the UB energies deficiency, the post menopause or the after the puberty or the after the marriage, chances are there most of the women having the urinary bladder pulse having the deficiency. On that specific time you wanted to just focus that particular region, definitely you can activate that point. That means you are activating, strengthening, stabilizing, reinforcing and manipulating to one particular organ, that organ to be known as a urinary bladder organ, you are strengthening, but at the same time, the woman having most of the times GIT related disorders, gastric. So that condition also can be disappear, or slowly it will come down, since you are depleted the energy of that particular organ, so that passing energy to the urinary bladder. So therefore, what are the organ clock timings of the UB? What is the peak time? 4 p.m. So 4 p.m. already having the enough energy, but what time we need to take the energy? 4 a.m. is advisable to apply this point. 4 a.m. may not be possible. Then think about that. The another complementary to that. So ST44, stomach 44. Where is the stomach 44 point is located? Come on, anyone in the Zoom or here? Where is ST44 point is located?
On the foot, middle finger of foot.
Good.
In between the thumb and the next toe.
Good. But you need to tell if somebody is asking you. Yes, precisely you should give the answer.
Foot, second and third finger.
Very good. Good answer. Midway between the second and third toe, half shown proximal to the web margin. In the depression, that point is located ST44 on the knee region. This is ST44. Now stomach 44, stomach organ clock timings? Yes, 8 o'clock is the peak time, right? 8 o'clock is the peak time. 4 a.m. is not possible, then the 8 a.m. is advisable to pierce that needle. 8 a.m., right? So otherwise, anytime you wanted to use that point, certainly you can use the UB40 point as a manipulation to be taken place, right? Further, you wanted to do the beauty of this another way, if we wanted to understand, on this specific region you can find the engorged veins. The veins are there, so that's called as a spider veins. So that veins, if you can see the blue color veins, then you just rupture that veins, or the puncture by using the 3-edged needle, or you can use by using the lancet, and certainly that will be useful. Puncture it on that specific region. That will be great changes. If the people who are suffering for the lower back pain, you know, it is also the distal point for the back conditions. This also can be applicable. So UB40 is the distal point for the back region. So therefore, anything is the lumbar pain, sacrum pain, coccyx pain. So 3 level of the pain, 5 vertebrae, again 5 vertebrae and 4 vertebrae. Totally 14 vertebrae out of 33. If the patient is getting the pain on that specific region, certainly that have the great impact to get instant patient feel some changes and also some amount of the relief. I believe if the acute pain is there, but greater than 50%, patient feels some kind of the changes on the UB40. So therefore, it is advisable the people who come for the back pain for the treatment, also make them to advise them, give the pressure on this particular point for 5 minutes in morning and 5 minutes in the evening time, and by giving the pressure bilaterally to the popliteal fossa region. Right? So therefore, once we activate, which side we need to be applying? So either side you can use it, or the bilateral would be more better, or the patient is complaining only on the ipsilateral or the unilateral pain is there on that specific time, certainly you just apply the point on that region. That would be better on the specific back of the knee. So therefore, hopefully you understand, but this particular point is numerous reasons to related to the back pain. Known and unknown etiology. The pathogenesis you may not know, maybe trauma or injury, or the PIVD, pelvic inflammatory disc related disorders also can be treatable. However, that is a mechanical related problem. Still this will be going to support, since this is supporting to the sciatica nerve as well, because the sciatica nerve starts from the L4, L5, S1, S2, S3 levels. muscles. So from there 5 vertebrae are involved. So that to become the one nerve, that nerve to be known as a sciatica nerve, descends to the downwards direction on the popliteal region. Then it divided into two. One is the tibial nerve, the other nerve to be known as a tibial nerve, and also the sural nerve. So it divided into few nerves on the peroneal nerve, so on. So therefore we understand we can treat for the sciatica conditions as well. If the patient is suffering on the ipsilateral region, then you just puncture it if the patient is suffering for the sciatica nerve related problem.